I wanted just to address a few things that come up from time to time, questions that I get from patients. Some of the women that I work with are concerned about doing resisted exercise because they don't want to develop big bulky muscles like a guy. From a physiologic standpoint, women don't possess the ability to do that like a man does because they lack a hormone that produces that response in the muscle. So when women work with resisted training, part of it is they're not going to be making the changes in weights over time quite as fast as a man will, but they also really don't possess the ability to develop the large muscle bulk that a man does because their body just won't produce that. Women will get tone, definition, and an increase in their ability to perform the activities that they want to perform, but they're not going to be changing in size, again, the way that men do. So how do you know when you've done too much? Well, one of the things that you'll see over time is that you'll have what we call diminishing returns. You'll be working the same amount, you'll be doing the same amount of reps, the same amount of sets, maybe even a little bit more, but what you'll be seeing is that it'll be getting more and more difficult over time rather than less and less difficult over time. You may find that you're having more difficulty getting things done during the day than you did prior to. That really means that you're probably overdoing it. So it's time to scale back your exercise and maybe even take a brief break. When you do suspect that maybe you've injured yourself, it's usually important to use the RICE principle, R-I-C-E, rest, ice, compression, and elevation. The rest allows your body time to heal. Ice acts as an anti-inflammatory. It helps to prevent additional swelling from coming into an area and helps to decrease that inflammatory response from the injury. Compression, again, helps to limit any kind of swelling, and the body uses that to help keep additional damage from occurring in the tissues that are around the area where the injury has occurred. And then elevation, also same thing. So what we're looking really to do is we're looking to quiet down any inflammation and then provide an optimal environment for healing to take place. As far as when it's appropriate to seek medical advice, to be honest, if you think that it's appropriate or you have any questions in your mind, there are medical professionals out there that can help you answer those questions. So right there, rule number one, if you think that you should, you probably should. If you don't think that you should, however, what you're seeing is that with rest, with the ice compression elevation, your situation isn't changing, then you should probably seek additional help. If you have inability to bear weight on your leg, that definitely is something you need to get looked at. Or again, if there's any additional swelling that's occurred even though you're not doing anything more, that clearly needs to be checked out. In physical therapy, at a most basic level, we are the movement experts. We treat people who have problems with movement. On a large scale, this is someone who can't walk, can't roll over in bed. On a smaller scale, it may be that a person can run, but they run with a limp. And so I'm either looking at movement from a big picture standpoint, again, with these patients that are severely debilitated, or at a small picture standpoint, where you have someone who generally is able to get through most of the things that they'd like to do, but they're having a difficult time with it. These patients, these movement problems can affect all of a patient's different systems, from their muscles and skeletal system, to their heart and lungs, to even their skin, their digestion, their circulation. These are all things that we have to take into account as physical therapy professionals. One of the main things that we use to treat these patients is therapeutic exercises. And what we want to do is we want to challenge their system, again, cardiovascularly, musculoskeletally, so that it responds, so that the next time we see them, they're capable of doing more. When we treat a patient with therapeutic exercise, we look at changes on a variety of levels. At the level of the muscle in the joint, we're actually looking at changes in the soft tissues around the joint, the ligaments, the tendons, even the joint surfaces. When you immobilize a joint for a long period of time, there are degenerative changes that go on in the tissues. On a very basic level, the collagen fibers in the tendons and the ligaments, they actually start to stick together. And so normal movement is necessary to get them unstuck and to get them working like they did before. Also, therapeutic exercise, we look at cardiovascular systems. So if someone has had a low level of activity or no activity for a period of time, we have to get their heart and their lungs ready to support the things that they want to do. So if you've been, say, someone who's been immobilized in a cast and they've been on crutches for a while and they really haven't been able to manage their own home or go out and get to the grocery store, we've got to work on the tissues that were in that cast, getting the muscle strong again, getting the ligaments back to their usual state. But then we also have to look at, can you walk 150 feet, 200 feet, 300 feet so that you can get through the grocery store? So as therapists, again, we use therapeutic exercise as one of our tools to get people from where they are to where the person would like to be. Some people ask about their diet. On a most basic level, you are what you eat. Our diet gives us the fuel to do the things that we need to do, and it also provides our body with the building blocks that it needs to improve and maintain all of the tissues that make us up. So when we look at the food that people eat, we want to make sure that people are eating healthy. We want to make sure that they're eating foods that contain all the nutrition that they need, that provide the caloric support for the activities that they do, and not too much that our body's taking those extra calories and storing them away. One of the things that I see as an outpatient physical therapist is some of my patients' problems are created just because they are carrying around a little more weight than their body has the ability to deal with effectively, and their joints, muscles, and bones are breaking down because of it. So nutrition as a whole kind of a concept is very, very important for exercise in general, and it's also one of the things that allows us to be able to do all the things that we need to do. When you're considering different exercises, you want to take into account the types of activities that you're interested in improving. So for people who are training for a sport, it's generally a sport activity, running, jumping, throwing, those types of things. And the activities that we use to prepare for those sports should look a lot like what you're doing. We in the clinic will say it's got to smell like function. So if I'm working on someone to enhance their golf swing, then I'm going to be using exercises that honestly look a whole lot like golf, both in direction, in muscle groups used, in speed. I may take the activity and break it down, but those are all going to be components of that activity. So your training should be specific to what you're doing. We're looking at not only adapting the musculoskeletal system, making the muscles able to handle loads, making their tendons that are attached to them able to handle those loads, the attachment into the bone of those tendons being able to deal with the stresses, ligaments, joint surfaces, and all that. We're also looking at your nervous system being able to access the different parts of the muscle. Muscles have areas in them that are specific to the range and the motion that you're working in, the speed at which you're working, and all the other different factors that come into that. So our training has to be specific to that so that all of those components can come together and enhance our ability to perform the activities that we want to perform.